So, good morning, everyone. I'd like to welcome you to our webinar on navigating the future of the NHS, how insurers and health tech providers can drive change. For anyone that doesn't know me, I'm Alistair Morris, and I'm a business development manager here at Hannover Re UK, and I'll be chairing the session today. So today, we're going to be exploring the challenges facing the NHS, which probably are no surprises to all of you, are rising healthcare demands, treatment backlogs, and delays in diagnosis, and how these are impacting on mortality and critical illness. We're also going to be looking at how insurers, when partnering with health tech providers, can help to address these challenges, which includes through supporting preventative healthcare through digital tools and enabling early diagnosis and intervention. Ultimately, this should contribute to better health outcomes for both policyholders and society more generally. So you're going to be joined by a couple of experts, and that includes Jack Hanley, who's a commercial partnerships and digital health advisor at FibriCheck. FibriCheck has developed a device-agnostic heart health software to detect and manage cardiac arrhythmias, ultimately assisting in preventing strokes and other severe conditions. Jack's going to take us through the reasons that their software may be an effective way to move from hospital to community and share the optimistic results that they're seeing with policyholders and insurers in a recent POC that they performed. We're also going to be joined by Ellie Yannick, who's an enterprise account executive at Dialogue. Dialogue provides a global wellness and engagement platform for insurers and employers, which aims to increase customer engagement and ultimately health outcomes for preventative care. Ellie's going to share with us the reasons why and how a platform like Dialogue could be a valuable tool to the NHS as we move from sickness to prevention and analog to digital. Following Jack and Ellie's talk, we're going to move into a roundtable discussion where we're going to be joined by Maria Pelkinen-Hall, who's a digital innovation manager at Hannover Re from our Stockholm branch. So she's going to be bringing her global expertise on digital trends and adoption to the roundtable. But before all of that, we're going to be hearing from our very own Vicky Webb, who's the head of biometric research here at Hannover Re UK. And she'll be setting the scene looking at the current state of the NHS, why we should be really proud of it, and the future challenges that it faces. But before I'm going to hand you over to Vicky, just a bit of housekeeping from me. If you did have any questions or comments during the talk, please do feel free to drop those into the Q&A chat on the Teams chat, and we'll do our best to address them during the roundtable. So with that, I'm going to hand you over to Vicky.
Perfect. Well, thank you very much for the introduction, Alistair. And I'm going to start with a whistle-top brief history of the NHS. So when it was launched in July 1948, it was the first healthcare system in the world to offer free medical care at the point of need to every citizen. And of course, this is funded by taxation. And in the decades since its launch, it's seen some great successes and innovations, and this ranges from reduction of diseases such as polio, whooping cough and measles through immunisation, through to very recent digital healthcare expansions, including remote consultations and use of digital tools such as the NHS app, which now has millions of users managing appointments and prescriptions. Other innovations over the years include the UK's first heart transplant, 1968. The NHS first used CT or CAT scans back in 1972. And during the 1980s and 90s, there was a transformation of mental health care out of institutions and into more of a community-based approach. 2002 saw the first successful gene therapy in the NHS. And then in 2007, there was the first use of a Da Vinci surgical robot arm, which has led to groundbreaking heart operations. It's also worth remembering that needs have changed. So the NHS was originally set up to get people better from specific acute illnesses. But in the 3/4 of a century since the inception, our health and care needs have changed. and the need for ongoing care for chronic conditions and preventative healthcare has gradually been increasing. And one example of how the NHS has looked to adapt here is the introduction of healthcare check screening in 2009. And this is where adults aged between 40 to 74 are invited to screen for risk factors relating to diseases such as cardiovascular disease. However, as Alistair said, it is no secret that the NHS is facing many challenges at the moment. And this section is certainly not intended to be a comprehensive assessment, but just picking up on some of the themes. The NHS now has to serve an increasing and ageing population. Although we're living longer, we can expect to spend more time in ill health. For example, the World Health Organization reported in 2019 that people living in the UK could expect to spend 14% of their lives, that's about 11 years, 3 months of their lives, in ill health. A further complication for the NHS is that they have to cope with many people that have multiple conditions that require ongoing care. And we also see an increasing prevalence in certain conditions such as diabetes, hypertension, and depression. And this all adds to the pressure on the NHS services. Another much commented and mentioned challenge is around increased waiting times, whether that's for diagnoses or for treatments. And this was a trend that was starting to become apparent in the years before COVID, but has been exacerbated by the pandemic. And as at June 2024, total waiting lists for NHS treatment stood at 7.6 million people. The largest group within that were working age adults. And we know that these delays can have an impact on claims. Any delays in diagnosis or treatment will reduce the chances of survival and potentially impact life insurance claims. And during the pandemic, when the NHS delayed, cancelled and postponed routine care, the industry saw a drop in critical illness claims of the order of around 10% at that time. I also wanted to comment briefly on the impact that all this has on the people that work in the NHS. And in September 23, the King's Fund reported that the overall NHS vacancy rate was the equivalent of a whopping 121,000 full-time roles. So obviously vacancies will vary by region and department, and it's worth noting that they called out mental health as being one of the worst affected here. Related to that, sickness rates can be significant as well. And again, what's also noteworthy is that mental health illnesses such as anxiety, stress and depression are often the most reported reasons for sickness. Moving on now to take a more detailed look at the picture of cardiovascular health trends in the UK. And this has really been a mixed picture. The past 3 decades, we saw. Sorry, Georgie, could you go back to the previous slide? Thank you. Yes, so in the last few decades, we've seen some really great advances in cardiovascular health. And until recently, mortality rates from cardiovascular disease have been on the decline. However, in more recent years, progress had started to slow. And the most recent data now even shows a reversal in this improving trend. There have been reasons put forward for this. The usual culprits have been put forward. Talk about increasing obesity and poor diet playing a part, alcohol consumption and sedentary behaviours. But it's also interesting to note factors that have come to light in more recent years as drivers of excess circulatory deaths. So examples such as potential increased cardiovascular risk after catching COVID. There's reduced management of hypertension during the pandemic, and strains on the NHS emergency response times can be particularly crucial for survival rates for cardiovascular events such as heart attacks and strokes. It's also worth noting that cardiology services have not been immune from long waiting lists, and the waiting times for cardiology planned hospital care have increased hugely over the past decade. Turning now to another one of the major themes around mental health. And mental health problems are very common. There's an often quoted statistic that 1 in 4 people will experience a mental health problem of some kind each year. I actually had a look into this statistic as research for this webinar, and I was surprised to learn how old it is. It's based on a survey that was published back in 2007, but I can imagine it's still very relevant today. And more recently, more people than ever have been reporting negative impacts on their mental health due to cost of living crisis and inflation. This increasing prevalence in mental health issues gives rise to an increasing need for NHS services, and adult mental health referrals have been increasing steadily at 3.3% per year. For children and young people, the picture is worse, and it remains to be seen what this will mean for future demand as this cohort ages. And as with other areas, waiting lists for mental health services are long, and over 1 million people waiting for mental health services, when 345,000 of those referrals have been waiting more than a year for their first contact with mental health services. So now looking ahead to the future and what's in store for the NHS. It's been in the news quite a lot lately. In September, the Secretary of State for Health and Social Care, Wes Streeting, made his statement announcing his 3 big shifts to secure the future of the NHS, from analogue to digital, hospital to community, and from sickness to prevention. This was followed up in the autumn budget last month, where the Chancellor announced a 22.6 billion resource spending in 2025 and 26. And in part, this is to deliver additional elective appointments and make progress towards some of those waiting list targets. In addition to that, there was a 1.5 billion capital investment set out to deliver capacity, amongst other things, for more procedures and diagnostic tests, and infrastructure such as new beds and reducing the backlog of structural repairs. Although the increase in the day-to-day budget was welcomed by many health experts, some have cautioned it's only in line with what we need to effectively keep the show on the road, and others that the capital investment that only be felt in certain places. So if we look even further ahead for the longer term, the government has launched a survey, and it wants to hear views from interested organisations as it begins work to develop its 10-year health plan for England. So it'll be interesting to see what emerges from that consultation. This brings me to the end of my section, but before I hand over to Jack and Ellie, I'll end with a few thoughts on how the insurance industry can do their bit to help. Firstly, as Alistair's mentioned, there's a role to play in contributing to preventative care, and this can reduce the incidence of chronic diseases, which account for a large share of NHS resources, such as GP appointments and hospital stays. Programmes focused on lifestyle interventions could help reduce the burden of conditions like heart disease, diabetes and obesity. And related to this, programmes that provide incentives to policyholders to maintain healthy lifestyles or meet certain health goals. In addition, offering access to digital health technologies can help reduce demand for acute services, and my co-presenters will speak more to this. I'll now hand over to Jack, who is next up to talk to you about FibriCheck and cardiovascular health.
Thank you, Vicky. Hello, everyone. My name is Jack. My background is helping care providers and insurers with digital health transformation. I've done this across a range of solution areas, but I'm really interested in early intervention and enhancing patient flow. I now work with FibriCheck in the UK, and FibriCheck are a global technology company who support cardiovascular diagnostics. In my 10 or so minutes today, I wanted to focus on a specific area of cardiovascular disease, cardiac arrhythmias. We know that looking after the ABCs of our cardiovascular health, that is arrhythmias, blood pressure and cholesterol, is the foundation to having a healthy heart. I tend to see that people have a pretty good grasp on the B and C components, and you see regular testing for these across healthcare and indeed at home for many, but perhaps there's less of a grasp on the A. For those less familiar with cardiac arrhythmias, they are a group of non-regular heartbeats. Atrial fibrillation is the most common one. It affects 1 in 3 people over the age of 45. It's also the one we should be most concerned about. Having AF increases your risk of stroke and heart failure 5-fold, and the chance of mortality from cardiovascular diseases more broadly 3-fold. So we can see that the statistics are somewhat against us. The characteristics of cardiac arrhythmias, and in particular atrial fibrillation, make it inherently difficult to detect, diagnose, and treat effectively. We can see here that they're not always felt, with the majority of atrial fibrillation cases not presenting with any symptoms. They're not always present, they come and go, which makes spot diagnostic assessments inherently difficult. And they're not always harmful. A palpitation symptom might be indicative of atrial fibrillation onset, but it also may be something else like frequent extrasystole beats, which are less harmful and may not require an immediate doctor's visit or diagnostic referral. Here is a typical patient case to illustrate these difficulties in practice. This is an example of a patient who feels some palpitation symptoms, chooses to go and see their GP. Current diagnostic approaches require an in-person visit where an ECG or a Holter assessment is completed. In this patient's case, they received a negative result and no further action was taken. However, the patient's symptoms re-presented a few weeks later, and so the patient has to schedule a new appointment, which incurs another period of waiting. And as we know, and as Vicky's just mentioned, waiting times across the NHS, particularly cardiovascular diagnostics, are longer than we would like. This can often be 8 weeks or even more in cases. So repeat assessments are scheduled, again using an ECG or Holter device under the supervision of a healthcare professional. This diagnostic journey is actually quite a common one. It's often referred to as the revolving door of cardiac diagnostics, which is not a great experience for patients, as you'd expect. Next slide, please. Thanks. Now, where appropriate, what if we take a digital-first approach that enables more longitudinal data collection? Well, this is how FibriCheck have helped a number of care providers and payers. With FibriCheck's data, we can create a richer picture on this patient's health. So yes, the patient was in regular sinus rhythm during their GP and hospital visits, as indicated by these green dots that we see with FibriCheck. But outside of this, there's clearly irregular heart rhythms indicated by those orange and red dots. The black dots along the top are reported symptoms. So we can see that over time, these symptoms increase in line with the frequency of the cardiac arrhythmias experienced. So this more longitudinal approach not only gives us a better chance of earlier accurate diagnosis, but the objective assessment of rhythm and symptoms and how they correlate over time can help inform clinicians on the appropriate next stages of intervention for the patient. So why must we adapt the traditional spot assessment approach and consider this a longitudinal way of working? Well, as mentioned earlier, atrial fibrillation is a leading cause of stroke, and this is perhaps the most critical thing we can address through a more effective detection and treatment pathway. Typically, AF-induced strokes happen in those cases that we saw on the previous slide. Patients are either asymptomatic or experience intermittent episodes and are therefore left untreated and progress over time. It's becoming more and more important too. So strokes already account for between 3 and 8% of critical illness claims. But as shown in the graph on the left, stroke incidence is increasing at a significant rate across European countries over the next 2 decades. This increase is largely caused by the factors Vicky's already mentioned. We're more sedentary, we're more comorbid, we have poorer metabolic health, and we have aging populations. Also, a fair proportion of this increase, it's worth noting, is from secondary strokes. It's actually a great way for critical illness insurers to have a fast impact, by the way. A number of our insurance partners focus on secondary prevention as a first step. The graph on the right shows that increased stroke prevalence will of course mean rising costs, as we'd expect. It's not just for healthcare providers, it's also for social care and also realised through lost productivity of our workforce, remembering that 25% of the strokes we currently see are within working age groups. In terms of the cost increase to care providers, The UK Stroke Association shows that next year, the cost of stroke care in the UK will be £43 billion. They expect this to rise to 75 billion in 10 years. That is nearly half of the current NHS budget. To close this slide off with a slightly more positive outlook, though, a reminder that 9 out of 10 strokes are preventable. It simply comes down to positive, proactive initiatives that intervene early, particularly with those that we know are at risk. Another reason we should consider this longitudinal approach to the diagnostic workup is so we can actually remove a lot of the wasted spend from the pathway. Data shows that across Europe, there are 300 million ECGs and 19 million Holter assessments per year, of which 80% are negative outcomes. That's over 1 billion euros wasted. Could I have a click, please, Georgie? There we go. In the previous patient example, we saw that the atrial fibrillation could have been detected much sooner, preventing that revolving door of diagnostics. But this longitudinal approach can also help us to identify those episodes that are not harmful and rule out serious conditions such as atrial fibrillation sooner. This approach gives the patient and healthcare professional the confidence to know when there is nothing present. We actually see in most of our projects that this is the biggest benefit to an organisation. The fact we're able to give reassurance and self-management information to users and prevent unnecessary onward referrals that contribute so heavily to that 80% wastage figure. Next slide, please. So what is FibriCheck and how exactly are we helping to improve the cardiac diagnostic space? FibriCheck is a software-only medical device. We differ from other cardiac diagnostic tools in that we're not depending on specific hardware or the direct oversight of healthcare professionals. Next click, please, Georgie. FibriCheck leverages our everyday devices, such as smartphones and wearables, your watches and rings. We utilize PPG technology, which we're all familiar with from the use of pulse oximeters. The assessment process is super simple. Taking the smartphone as an example, an assessment is completed by simply placing your finger on the rear camera of your phone for just 60 seconds. And following an assessment, data is reviewed by our algorithms and our team of cardiology experts. We classify 14 different types of cardiac arrhythmias, including AF. And we've been evidenced to detect atrial fibrillation with an accuracy of 98.3% sensitivity and 99.9% specificity. And finally, we report these results and provide insights and education to both the user directly and, if desired, to the partner's medical team, so that the appropriate next steps in care can be coordinated. So with FibriCheck's software-based, hardware-agnostic approach, we are easily utilized right across the patient's life cycle, as you can see here. Today, I've focused on why we need to take an approach that's new in these early stages of the pathway. These are certainly the most impactful, given it applies at such huge scale. And next slide, please. And here's some data from a health insurance partner who have delivered FibriCheck in exactly this way. Their members have unlimited access to FibriCheck, so they can self-assess as a prevention step or as a way to get fast answers when they feel some symptoms. Across this partner's population, there have been 16,000 assessments taken to date. We've seen a atrial fibrillation detection rate of 4.3%, which is roughly 4 times higher than the NHS standard detection rate. So we can see we're clearly moving the needle on early detection, earlier intervention, and stroke prevention. And on the other side of the coin, we see that of all of the assessments, 37.5% of them had some symptoms reported. So that's about 6,000 assessments from the total figure. What's interesting is that FibriCheck was able to determine that 95% of these are harmless symptoms, and only 5% were classed as clinically relevant and would therefore require a referral to a GP. It shows that a large proportion of symptomatic patients can be effectively managed through FibriCheck and provided some educational information instead of receiving a referral. If we were to take a typical cost of a GP appointment of £30, this would translate to roughly £171,000 of saving from unnecessary GP appointments, not to mention the cost of onward diagnostic referrals. So in summary, there are potentially huge benefits to be had for both patients, providers and payers by more effectively detecting and ruling out cardiac arrhythmias. And if incidence forecasts are correct, these benefits are only going to increase. That brings me to a close. Thank you so much for listening. I'm happy to take any questions in the roundtable, or feel free to get in touch directly after the webinar. I'll put my email in the chat. Now over to Ellie.
Thank you, Jack. So my name is Ellie. I've got a background in medical devices and employee wellbeing, and I now work for Dialogue, where I work with insurers and healthcare providers to support them with digital innovation to move towards a more sustainable, more preventative healthcare model. And today I'm here to talk to you about Dialogue's digital health engagement platform and its role in promoting preventative care. Next slide, please, Georgie. So I wanted to start with some scene setting. Vicky has already given us a very interesting, albeit slightly concerning insight into the current challenges that our NHS faces. And, you know, although the recent budget promises more spending on health and social care, as Vicky flagged, you know, it's really just enough to keep the NHS afloat rather than what the investment that's needed to help it thrive. So that really brings us to the critical role of prevention, which is no longer just a goal in healthcare. It's now really a necessity for long-term sustainability. Projections from the Health Foundation show that by 2040, over 9 million people in England, so that's nearly 1 in 5 adults, will be living with chronic illnesses like dementia, cancer, heart disease, diabetes and depression. And that represents a 37% increase from 2019. And we know chronic diseases already account for 80% of healthcare costs globally, and that really affects not just the NHS, but of course also, you know, families and workplaces in our communities. And these figures really highlight a very urgent need to prioritise preventative care. And we know public health interventions can yield really impressive return on investment, as high as 14 to 1 for general health measures and up to 24 to 1 over a lifetime for mental health interventions in young people. So these numbers really highlight how the benefits extend not only to our individual health, but also to the wider economy, particularly for employers and, of course, insurers and health providers as well. And digital tools are absolutely essential to making preventative care accessible to larger populations. They are, you know, effective, they're affordable, they're scalable, and they can also be personalised to guide people towards the right care for them, which essentially gets people support sooner, and that can prevent things like unnecessary GP visits or insurance claims. So today I'll talk about how Dialogue supports this shift towards preventative care with our digital health engagement platform, which is really designed to encourage proactive engagement with health and wellness. But firstly, I will just do a quick intro to Dialogue. So our digital health engagement platform is used by some of the world's leading insurers. We support the wellbeing of over 7 million members globally. And through our platform, we're really redefining the insurer-customer relationship. So by focusing on personalised wellness, we enable insurers to really kind of connect with their customers on a much deeper level. And in a world where we know customer expectations are constantly evolving, staying relevant is, of course, very key. And our solution really integrates wellness into the fabric of insurance offerings, making insurers a very integral part of their customers' daily lives. And in doing so, we help insurers to offer value beyond just traditional coverage by aligning with the very wellness-centric lifestyles of modern consumers. So how does Dialogue promote preventative health? Well, our digital health engagement platform uses proven behaviour change science principles, which help us to get to the root of people's established behaviours and kind of refocus them to adopt lasting, healthier behaviours. And recognising the very kind of interconnected, very mutually reinforcing relationship between the different areas of wellbeing, we take a very holistic approach covering all the key wellbeing pillars from the physical, the mental, the social and the financial. And central to our philosophy is the importance of physical activity, which is often hailed as the wonder drug by health scientists because of its very significant role in reducing chronic illness and mental health risks. And we use a variety of different tools and features to promote physical activity, things like fitness tracker syncing, personal activity tracking, exciting activity challenges, to really kind of encourage users to meet the World Health Organization's guideline of 150 minutes of physical activity per week, which is really the minimum amount of physical activity we want to see people doing to promote good well-being. And features like challenges also promote social connection, really kind of building a sense of community to promote social well-being. For mental health, we've got a range of tools like mindfulness and meditation practices and self-guided cognitive behavioural therapy. We also have an extensive content library which spans really diverse wellbeing topics, from diet and nutrition to financial wellbeing and sexual reproductive health and much more. And we've also collaborated very closely with behaviour change science from UCL to develop a range of preventative healthy habit plans, which really encourage users to adopt very sort of small, achievable, but also meaningful everyday changes that can drive those sustainable long-term lifestyle improvements across areas like sleep and stress and substance abuse and so on. Now, I, of course, mentioned the importance of physical activity promotion for overall health, so much so that it's actually a key component of the NHS long-term plan, which is a 10-year strategy launched in 2019 to address NHS challenges and improve public health outcomes. And you can see on the left-hand side there the very significant impact that just 150 minutes of physical activity per week has on reducing the risk of numerous chronic diseases and all-cause mortality. And the examples that I've listed here are really just the tip of the iceberg. And also you can imagine how much greater the risk reduction is when exercise is increased above 150 minutes of physical activity. And we know, as Vicky mentioned earlier, that the care of people living with often preventable chronic conditions makes up around 50% of GP appointments and also around 70% of hospital days, which really kind of brings home the very significant impact that increasing the nation's physical activity can have on reducing public health costs and contributing to much longer term sustainability in healthcare. And if you look to the right, you can see also the very significant implications that has for insurers when you look at some of the top drivers of CI claims. So cancer, for example, we know is a top driver of CI claims, around 65% on average. Of course, that will vary between different insurers. And when you consider that just 150 minutes of physical activity per week can reduce the risk of both breast cancer and bowel cancer by 20% each, it really kind of highlights how physical activity promotion is such an important tool in any insurer's preventative health arsenal to really drive down claims. And those are just a couple of examples. Increased physical activity has actually been linked to a reduced risk of contracting over 13 types of different cancer. So that includes bladder, kidney, lung and stomach cancer, just to name a few. But of course, stroke and heart attack are also fairly key drivers of CI claims as well. Jack talked a little bit about the stroke piece just now. And studies have also shown that meeting that magic number of 150 minutes of physical activity per week can reduce the risk of heart disease by 35%, which is pretty significant, and stroke by 25%, which again shows the very significant impact that physical activity promotion can have for insurers, as well as for individuals and, of course, for the public health system. And from our internal data at Dialogue, we know that 86% of Dialogue users meet or exceed at least 150 minutes of physical activity per week, compared with just 63.4% of the UK population at large. And crucially, what we've seen is that amongst our sedentary users, which are, of course, typically the highest risk group that you really want to target with these kinds of interventions, we've seen an average 75% increase in their daily steps after they join our app. So we know that our approach is effective at promoting physical activity to reduce those health risks. But of course, it is also now widely understood that physical and mental health are very deeply interlinked. Again, you can see here the very significant impact that physical activity can have on mental health outcomes. For example, studies have shown that 150 minutes of physical activity per week can reduce symptoms of anxiety and depression by 26% and 30% respectively. And physical activity can also be up to 1.5 times as effective as medication for the treatment of mild to moderate depression and anxiety. But one thing that is often overlooked is the inverse relationship between mental and physical health in terms of the impact that poor mental health can have on physical health and physical health outcomes. So depression, for example, has been associated with an increased risk of heart disease, which is why it is so important to really take that very holistic approach, which doesn't try to separate the mind from the body. And I just wanted to finish by summarising the value that this approach has for insurers. Firstly, we've discussed how using these kinds of digital tools to really empower members to adopt proactive health measures can help insurers to mitigate claims risks by reducing the risk of chronic disease. Using digital tools like Dialogue's platform can offer sort of streamlined, connected, very personalised user health journeys, and that can ultimately improve member satisfaction by improving their experience and their access to care. There's also evidence that offering wellness programs can attract more health conscious customers. So, of course, that then builds a sort of lower risk, more sustainable member base. It can also enhance your brand value as well. It really kind of positions your brand as very innovative, very caring, and very aligned with your members' needs. But finally, and I think very crucially from an insurer's perspective, it really arms you with loads of rich data insights and analytics, which you can use to help you build more holistic customer profiles, to help you personalize services, improve risk assessment accuracy, for example, and really to kind of inform how you develop your services in line with the needs of your members. So I hope that just gives you a little taste for the importance of preventative digital health tools in sort of shaping a more healthier, kind of more sustainable future. And now I will pass over to Alistair to kick off the roundtable discussion.
Thank you, Ellie, and of course to Vicky and Jack also for sharing. I think that was all very, very interesting and tees us up really well to get into about 15 minutes or so of roundtable discussion. But first, just a final reminder, if you did have any questions or comments, do feel free to drop those into the Q&A chat, and we'll try to address those as we start going through all of this. So, Maria, I'd like to bring you into the discussion now. Why is this shift to digital technology and the platforms so important now more than ever before?
Consumer expectations have already changed or is changing in all other industries, including retail and the bank sector, and it will force insurers to adapt accordingly. There is no return, really. Influenced by achievements in technology and the demand for personalized experiences, they pose challenges for insurers that want to stay relevant. And to meet these customer expectations by embracing the usage of technology, insurers could prevent claims through proactive preventative mental health care like Dialogue offers. We see a shift from traditional wellness apps towards health management apps. Through these new devices, applications, and applying machine learning, predictive analytics is another area that could impact claims severity or even claims frequency. We could potentially also reduce claims period through precision medicine or targeted treatment for critical illnesses of certain cancer types, early intervention, or tools for remote medical care, like FibriCheck, monitoring cardiovascular measures through wearables like smart rings, watches, or mobile phones, provides valuable insights for both underwriting and health management in the favor of the end customer, the insurer, and NHS.
Great. Thanks, Maria. And just wondering, do you see differences globally?
Well, during the pandemic, many industries shifted to a fully digitalized distribution, also in the insurance industry, being either direct to consumer or via agents through automated underwriting engines. Some markets like US already imported third-party data from prescribed drug registers or motor vehicle datasets and has since continued the digital shift with fetching electronic health records like lab test data from clients consenting. Hannover Re in US has developed ratings accordingly that reduces the need for additional medical testing, enabling auto decisions, which also is usable for underwriters in more traditional companies. Australia is similarly adding electronic health records into their underwriting process, as well as using apps or devices to identify preferred lives, which is providing a smoother onboarding journey for the end customer, as well as reducing costs for the insurer or even helping them develop products for impaired lives. Imagine combining third-party data with gene tests, not so much in the underwriting phase, which can be challenging in many countries, but for the health management to reduce the risk of diseases. In some of the Nordic markets, the discussion has been around if the national healthcare, similar to NHS, are prepared for the increased number of patients that much earlier seek care due to genetic indications of severe diseases or even signs from devices that they use.
Yeah, that does sound like a challenge. All right, so moving on to Ellie and Jack. How do you increase user adoption and engagement with these digital health apps? Maybe let's start with you, Ellie.
Yeah, that's a really great question. And of course, one that is absolutely critical when it comes to sort of driving health improvements and, of course, ROI. And it really starts with removing barriers to adoption. So behavioural change science plays an important role here. At Dialogue, to guide our engagement strategies, we use what's known as the EAST framework. So easy, creating a frictionless and intuitive experience that sort of helps users find what they want easily without overwhelming them. Attractive, so the platform is visually appealing. That's actually one of the first things that people comment on when they see our app. Social, so we leverage social features to build a sense of community, which has been proven to be hugely effective at driving engagement. And then timely, so it's all about kind of creating trigger actions, which could be things like push notifications at optimal moments when people are likely to be most open to engage with their health and open to change. Things like New Year's resolutions or Mental Health Awareness Week, for example. And we also use gamification as well to really kind of tap into people's intrinsic motivations. So features like wellness challenges, keep things fun. They add a little bit of friendly competition. And the goal from our perspective is really to make sure that that enjoyment that people get from using the platform translates into a genuine love of healthy living and wellness beyond just the game. So ultimately, it's all about creating a platform or an experience that feels very effortless, very rewarding, and something where, you know, it kind of shows people that improving their well-being isn't just achievable and manageable. It's also something that can be fun and enjoyable as well. I think that's really key to engagement.
Thanks, Ellie. Jack, did you have anything to add on that?
Yeah, so I guess there are a few different elements to cover on the topic of user adoption. I think the approach really depends on the use case. So, I mean, I covered a few different use cases for the FibriCheck technology in my presentation. So maybe just taking those as an example of kind of how it might differ in approach. I think a key point for FibriCheck, or similar solutions when they're used as a primary detection solution, is starting with education and awareness. A lot of emphasis needs to be put on those fundamentals to, first of all, improve health literacy of members and help them understand the reasons why it's important to them. We typically see that for those use cases, good old-fashioned newsletters, email newsletters with clear call to actions and links to longer form video content, for instance, work really, really well at getting user adoption. Also worth noting that the more targeted you can make those campaigns, for instance, if you start by focusing on a population that already has risk factors and personalizing the reasons why to them, that makes adoption a lot easier. And then the other use case I spoke about, maybe to give an example of that, so that's more of an in-pathway use case. It's triaging symptoms to improve patient flow. That's less about education and awareness and more about focusing on the user onboarding journey. So how do you make that process as frictionless as possible? It's why FibriCheck offer a number of different integration models. So we've got an app-to-app option or even an SDK option where you can bring the assessments from FibriCheck's technology into a native insurance app or healthcare providers platform, for instance.
Great, thanks, Jack. Ellie, just on your response, just coming back to that, does the strategy that you use differ by the audience? So, you know, insurance policyholders versus, I guess, general public?
Yeah, I mean, I think it can do. I think driving adoption of these kinds of digital tools and wellness apps and things like that in public health settings can be uniquely challenging. I think the strategies broadly remain similar, but often should include things like potentially providing educational resources, so things that can be targeted not just at the end user, but also at health and social care professionals. So then you're empowering them to promote those digital tools within their communities, and really cascade those messages, because obviously that can be really difficult for the NHS or bodies like the NHS to do to end users at a national scale. And also it can be helpful to kind of promote relevant tools within the app. Things like our healthy habits programs, for example, alongside broader public health interventions. So things like Stoptober or Dry January. So that is a way of kind of making sure that the message is getting out there, sort of linking it to campaigns which tend to drive or generate a lot of engagement already. But I think, ultimately, whether we're working with insurers or the general public, it really comes back to those key sort of behavior science techniques I mentioned earlier, all around the kind of gamification and building that enjoyment, and really kind of breaking health and wellbeing down into more manageable steps that make people feel like it's something that they can kind of achieve. I think that's key across the board.
Yeah, that makes a lot of sense. So just Jack, to you, one of the questions has come up. What additional functionality does FibriCheck offer over Apple Health app and Google Fit app, which can both do heart rate analytics?
Yeah, so I think those products are fantastic. They give a kind of a holistic picture of somebody's health. There's some kind of core differences in terms of how a Apple Health or Google Fit application would detect cardiac arrhythmias, for instance, kind of going back to the examples in my presentation. They tend to adopt kind of continuous monitoring approaches, which can lure the user into a false sense of security of when they're being monitored, because if you have significant motion artifact, which you tend to if you've got a wearable on and you're doing a lot of exercise, it won't always actually take readings during that period. So because there are intermittent cardiac arrhythmias, as I discussed, it can lure the user into a false sense of security if they don't receive an alert, but actually the assessments weren't being taken. So we do believe that kind of that spot assessment approach is best for accuracy. We've also kind of we've done a number of accuracy comparison studies between FibriCheck and the PPG and ECG elements of those devices as well, and shown and evidenced increased sensitivity and specificity with FibriCheck, and also less insufficient data quality because of that assessment approach. And then in terms of kind of broader functionality within the FibriCheck app, you have tailored information and education relevant to the user's symptoms reported, and of course their heart rate and rhythm data. You have those actionable insights, so clear recommendations of what to do when. So that really helps make sure that the right patient goes to the right doctor at the right time. And there's broader functionality there as well to support broader cardiovascular concerns. So you can monitor other cardiovascular conditions such as hypertension by logging weight, logging blood pressure in the FibriCheck app. Hope that helps.
I think that was very comprehensive. Thanks, Jack. All right, I think we've got time for maybe one more question. So, Vicky, what challenges does the NHS and insurers face when adopting preventative digital technology? Appreciate you haven't got a huge amount of time here.
Yeah, okay, I'll try and keep it brief then. So to answer the last question first, I think, can the NHS cope with increase in prevention? I think it's probably going to have to, and it can if starting small, test cases, checking if there are things that can be effective, and then rolled out, so sort of test and learn approach. And then challenges are yeah, the usual one, funding is probably something that will come up and be a constant question there. But sort of related to that, but more specifically, I guess getting the infrastructure up to scratch, the technology, the IT, and also the people skills with digital, the people that work within the NHS, and then insurers. It's kind of a slightly different question there. So they, I guess, have to cope with, or they have to cope with all of this extra data that they can be potentially getting, and the responsibilities that come with that. Obviously, data protection, people putting a lot of trust in that data, and so we have to look after it and make sure that we are using it in the right ways that people are comfortable with.
Great, thanks, Vicky. So we've got about 4 minutes left, and the last thing I wanted to do was to go around the table and ask each of you to provide a summary of your future outlook for the NHS. So not too much time, so nice and short and snappy, please. Maria, can we start with you?
Embracing technology allows insurers to prevent claims through proactive healthcare and reduce claims periods, benefiting the insurers and public health system like the NHS. And these opportunities require strategic foresight, technological agility, and a commitment to meet evolving customer needs. And I'm happy to say that we at Hannover Re have partnerships to support you in this transition.
Thanks, Maria. Vicky, do you want to go?
Sure. Yeah. So, yeah, I can't get away from the fact that challenges the NHS are going to be with us for a while, but I think, really want to remain positive and optimistic. There's a lot of positive stuff coming up in the pipeline, technological advancements, harnessing AI to help actually within the NHS, and then others that are more about individuals engaging more with their own health, like we've talked about today.
Yeah, should I go next? I think we have to live in a world where digital health services underpin prevention and care access. So digital front doors, for instance, where we hear branded around a lot now. I think the potential for these technologies are absolutely huge. Technologies like FibriCheck, they're novel, that they've achieved incredible accuracy and reliability in that software-only delivery model. So I think that's really the advent of using technologies that can scale and be used at that population level and kind of front door access level really effectively.
Cool, so I'll close. So, obviously we live in a rapidly changing world, and people from a healthcare perspective are really expecting services that cater to their very individual needs on a very, very personal level. But they're also increasingly expecting not only private providers but also the NHS to anticipate their future health requirements as well. So to meet those needs, we at Dialogue are investing very heavily in AI. I mean, that's really the technology of the moment, of course, and it's all about providing very tailored health recommendations using real-time data. And of course, I think AI, has huge implications across the board for both insurers and for the NHS in terms of automating processes, diagnostics, self-management, triaging, things like that, which can really help to reduce NHS backlogs and waiting lists, as we've already seen it having done in dermatology, for example. So yeah, I think it's all around that kind of personalization and automation, but also kind of balancing it with a human touch as well.
Great. I mean, the future does definitely sound very optimistic. So I'd like to thank everyone for joining today, and thank you for the question. We'll be following up by sharing this recording along with an article with the key takeaways shortly after this. And Georgie is going to drop through a link into the chat now, just for a survey. So please do take just a couple of minutes to respond to that. The feedback we get there is extremely valuable and helps to shape what we present on in the future. And of course, if you sort of had a question, but you didn't want to ask it today, we've got the contact details up on the screen now. So do feel free to reach out to any of us with those questions, or if you have any ideas to explore either of the technologies that we presented here today further. So with that, I'd like to thank the panelists and Georgie, who did a lot of work behind the scenes. And I guess I'm certain that I'm not alone when I say that today's talk was incredibly insightful. So thank you very much. Goodbye.
Thank you. Goodbye.
Thank you.